All right, after your surgical procedure is done, you'll come into the post-anesthesia care unit. This is where you're going to recover from your surgery, from anywhere to 30 minutes to an hour, depending on the type of anesthesia you received. We have two phases of care, phase 1, phase 2. So phase 1 is your immediate post-op state. We roll you into the PACU. You are all mummied up in blankets because in the OR it is very cold. So don't be surprised if you wake up with a bunch of blankets on you. A lot of times you actually won't even remember the first 30 minutes of your recovery, so that's important to note just because of the anesthesia side effects. Once you come in, we hook you up to the vital sign monitor. You will be getting vital signs every 5 minutes in that first phase. Like I said, the first phase is 30 minutes. We monitor you very closely. We control your pain the best we can. It's also important to note that your pain isn't going to be fully controlled. You did have surgery at this point, but we want you to get to a tolerable level, so we manage it the best we can. We also manage your nausea because sometimes side effect is nausea after surgery. How's your pain doing?
It hurts, but it just kind of it hurts.
Okay. Is it at a tolerable level right now?
Yeah, I can handle it.
Okay. So once your pain and nausea is tolerable and your vital signs are stable, we move you into what's called phase 2. So phase 2, we disconnect you from all the monitors. At that point, that's when your family members are actually allowed to come back. So before this point, while you're in phase 1, the surgeon will generally come out and go into the waiting room and talk to your escort, your support person, your family member, whoever's with you, and they'll kind of give them a rundown of how the surgery went and give you some post-op instructions. They will not come back to your bedside during that first 30 minutes. But during phase 2, that's when we bring them back here, so they'll be at your bedside. This is when you can also eat and drink, so that's everybody's favorite part. You can finally have something to eat and drink. And then we can also control your pain with oral pain medication. That's going to last a little bit longer and hopefully get you to an even tolerable level at that point. During this phase, that's when we also let you get dressed back into your civilian clothes. We give discharge instructions, so part of that is to have your escort person here. They have to be here for us to give discharge instructions because the anesthesia causes you not to remember things, and we need somebody to know exactly what to do for your care. At that time, they also get medications from pharmacy. They may receive them before coming back actually, but sometimes they receive them back in here, but pharmacy actually comes to the bedside to give them your discharge medications. Once all of that is done, pain is tolerable, vitals are still stable, and all discharge instructions have been given, you're dressed and ready to go home. So Sergeant Myman is done with his recovery. We're ready to let him go home. So at that point, we're going to assist him out of bed. And generally at this point, we've already sent your escort, family member, whoever's with you that day out to the vehicle to bring it around to the front doors of the hospital. A member of the nursing staff will then escort you out to your vehicle. As you can see, he's wearing comfy clothes, so the day of surgery, please wear comfortable clothes. And then you'll be on your way.